Everybody wants to be Superman in the bedroom, but of course, that's not always possible. But with the help of Dr. Harry Fisch, we're going to try to get you to at least the level of, say, Clark Kent. I'm Dr. Jon LaPook in Central Park, and welcome to CBSDoc.com. So we're doing a show for the web about male sexuality. Male sexuality.
Wow, that's a broad question.
There's a lot I don't know.
Oh, let's see. You know, I'm going to be talking to a male sex expert, so it's a free advice.
I could have a question, but not in front of my girlfriend, right?
And when did he start screaming like this?
Since last night.
I don't really know what I don't know to ask a question about, really.
Penis enlargement.
Men can get turned on by a breeze.
And why that is?
I have no idea. That's what I'm asking.
This is my friend, Dr. Harry Fisch. Harry, introduce yourself.
I'm Harry Fisch. I'm a fertility doctor. I'm a professor of clinical urology at Columbia University Medical Center, New York Presbyterian Hospital.
One of the questions we had was from one woman said, what is it with guys? They always seem to be aroused, you know, you snap your fingers, they're aroused.
Like the majority of men are more interested in sexual things than women are.
It seems that most things turn men on.
Do you think men differ from women in that respect?
Oh yes, definitely.
Is there a difference between men and women in terms of that?
Well, men get aroused much quicker for the most part. And it turns out years ago, when we were cavemen or even before, we were not in a safe position when we were having sex. We were always at risk of being killed by animals. So we had to have sex and then leave. And now, you want to spend more time having sex because we're in the comfort of a house, we feel more safe. So that issue is not there.
So how do we overcome this evolutionary wiring that you say we have that makes us want to have sex very quickly and then run away so that we can linger longer and have the woman have more pleasure? What do we do about that?
I have no idea.
You heard it here from Dr. Harry Fisch, expert in sexuality.
Do you have an answer for that?
Absolutely. It's communication. Stay a while. Take your time.
Oh, I see. Okay.
Talk. And also, figure out where things are down there. Don't you think that a lot of men don't know where things are? Do you think guys know where everything is?
No. They are too cocky to actually, you know, learn about it or educate themselves, or they're maybe embarrassed about not knowing.
In this country, you get sex education in some areas of the country, really in junior high school and a little bit in high school. But you don't really get a lot of sex education once you start having sex. So sex education for adults is something that's very, very important, because if you have problems having sex, I will guarantee you're going to have a relationship problem, and you could easily have a fertility problem. And if you have problems in the bedroom, it could really indicate a medical problem. A lot of guys don't know what it takes to pleasure a woman and to pleasure a woman on a regular basis, and they don't really know if they have a problem. The most common sexual dysfunction is premature ejaculation. How long should you last intravaginally? And it turns out it's supposed to be between 5 and 10 minutes. If you on penetration are only lasting less than 2 minutes, you have a problem. Now, your wife or girlfriend or partner may not tell you, but most of the time they're very upset. And now we know that there are certain treatments for it. And what's amazing is when we treat couples for premature ejaculation, both the couples are happy, the wife is happy, the partner is happy, and the relationship really improves. So that is something that can really affect not just sexual function, but the relationship and well-being.
Penis enlargement. And do the pills really work? And what is the business behind that?
Well, you know, a lot of people are worried about the size of the penis unnecessarily. This book is about, 5 inches in length, and that's the size of an erect penis. And nearly all men are about the same size. Very few men have very small penises.
What about these products that people sell?
Yeah, well, when we talk about penis enlargement, people are thinking increasing the length of the penis. And there really is absolutely no way of increasing the length of the penis. However, what people don't realize is the width, the girth of the penis is very important. So a firmer erection will give you a wider penis. So the way to really increase the size of the penis, which is really the width, is to increase your health, the blood flow to the penis. And factors that do that are eating a proper diet, exercising. Viagra, of course, helps it. Products like Viagra, because it increases the blood flow to the penis.
So these products that are advertised on the internet?
These products are scams. Some of the misconceptions that men have when they're arriving here is that their problem is unique to themselves. And the truth is that a lot of the problems that they're having, whatever the problems may be, is very common.
People are talking about ED and stuff like that.
Erectile dysfunction.
Yeah, so I would like to know if you can touch like younger people or
around what age? 50, 60, 75? That's what I want to know.
Erectile dysfunction can occur at any age. In fact, what is the definition of erectile dysfunction? It's inability to perform sexually in bed or otherwise, but it's different if you're younger compared to older. Younger men tend to have erectile dysfunction because of stress and anxiety, performance anxiety. As you get older, the erectile dysfunction is different in your 40s, 50s, and 60s because it may be related to heart disease and other issues that are going around there.
What about medication?
Medication is interesting. A lot of people don't know that certain medication can cause erectile dysfunction.
What about alcohol?
With alcohol, we know that a little bit of alcohol increases the desire, but too much alcohol decreases the ability to have sex. Actually, alcohol is a depressant. So if you drink too much alcohol, you're sleepy. You're going to miss the entire opportunity to have sex. So we always recommend not too much alcohol. A little bit, okay. Too much is no good.
There was this poster of Superman. I said, well, every guy wants to be Superman in the bedroom, but you can't always do that. But with the help of Dr. Harry Fisch, maybe you can at least be Clark Kent. Can you help everybody out there be at least Clark Kent, Harry?
Absolutely. We can help people be at least Clark Kent, and maybe even better. A lot of people don't know that the problems they have, a lot of people have it, and they certainly don't know that you could actually treat it and improve your sex life.
Are you still active, if I can ask?
Yes, I am. We are. Particularly her. Yes, we are.
Any issues that you have now that you didn't have, say, 40 years ago?
Oh, yeah, I'm not the same. I'm better, actually, but no.
We've been married a long time, but we're active.
I don't think you can have a healthy sexual relationship without a healthy regular relationship.
You guys seem to have a very good sense of humor about sex. Is that important?
Yeah, I think so.
Have you ever had a really huge laugh during sex?
Yes, last
Oh. Is there anything that drives you crazy about men?
Many things.
I can't believe that this guy finished a sentence.
Hasn't called.
It's clear that any discussion of male sexual dysfunction has to include not only physical, but also emotional issues. It's not just about technical difficulties. The plumbing can work perfectly well, but it's still sexual dysfunction if couples aren't communicating, if they're not tuned in to each other's satisfaction. And guys, if you say you're going to call, call. Thanks to Dr. Fisch, and thanks to all of you for the lively discussion on the CBS and Huffington Post websites about last week's medical marijuana segment. Please email me at doc@cbs.com. Next week, I'll be taking you inside a New York City ambulance. Until then, I'm Dr. Jon LaPook, cbsdoc.com.